Thank you very much for this introduction. So as we've already talked about, operating rooms are extremely resource intensive and represent approximately 50 to 60% of the consumption supply chain of a hospital. So a 2021 study performed at 3 different healthcare institutions found that the operating rooms had an annual carbon footprint of approximately 9.7 tons of CO2. I just realized I didn't change my slide. Which is the equivalent of over 1 million homes' energy use for 1 year. So climate change does present one of the most significant global health challenge of the 21st century, if not the most significant global health challenge. Yet it also offers an opportunity to reshape the social and environmental factors influencing health. So the NHS, which is the public health care organization of the UK, has put forth numerous recommendations in an effort to reduce carbon waste products from our healthcare system. And one of these recommendations emphasizes enhanced patient recovery and reduced length of hospital stay. So to align with the NHS recommendations, as well as address the substantial challenges of the environmental impact of operating rooms amid, again, the urgent challenges of climate change, we decided to investigate the carbon footprint of different surgical colorectal care pathways. More specifically, our study aimed to estimate the environmental impact of same-day discharge care pathways compared to standard inpatient enhanced recovery pathways management for patients that underwent minimally invasive colectomy as well as stoma reversal. So in order to do so, we did a retrospective chart review, which included adult patients who underwent elective colorectal surgery at a university-affiliated colorectal referral center from October 2017 to December 2022. So the study comprised 2 cohorts, one who underwent minimally invasive colectomy or stoma reversal with an established enhanced recovery pathway targeting a 3 days length of stay, and the other one who underwent same-day discharge after surgery. We used Corson exact matching to create comparable groups where age, body mass index, sex, Charleston comorbidity index, and procedures were matched. So our primary outcome was the total carbon footprint in kilogram of CO2 equivalent from 60 days before surgeries to 30 days after surgery, counting for the average wait time from initial consultation to surgery to recovery, as our goal was very much to capture the entirety of the care pathway. So in order to do so, we used a calculator named the New Care Pathway Carbon Footprint Calculator, which is a tool that was developed by the Sustainable Healthcare Coalition in collaboration with the NHS to estimate the carbon footprint, again, in kilogram of CO2 equivalent per patient. So the tool requires the input of variables such as the number of initial surgery consultation, emergency consultation, the number of ICU versus ward days, the number of surgical procedure hours, prehab visits, the number of MRI scans, medicine expenditure, and travel data. So for our results, we had a matched enhanced recovery pathway cohort of 209 patients and a matched same-day discharge cohort of 96 patients. The carbon emissions from managing a minimally invasive colectomy with an ERP instead of a same-day discharge resulted in a mean difference of 421 kilograms of CO2 equivalent per surgery. Similarly, as for stoma reversal management, we also found a mean difference in between the 2 pathways that was of 279 kilograms of CO2 per surgery. So these are quite abstract unit of measures which we don't really use in our everyday life yet, and whose impact is hard to grasp, but in more tangible terms, if we consider that there's an average of 600,000 minimally invasive colectomy performed in the US per year, this would mean a difference in carbon emission equivalent to 60,000 gasoline-powered vehicles that are driven annually. Similarly, if we consider there's around 50,000 stoma reversal in the US per year, this would mean a difference in emissions equivalent to driving around 34 million miles in an average gasoline-powered vehicle again, which would basically allow you to travel around the Earth 1.4 times. So enhanced recovery following surgery has resulted, as we know now, in patient improved outcomes, but also in a reduction of environmental impacts. So these results do advocate for more in-depth research on the environmental impact of these care pathways and for the broader use of an economic, environmental, epidemiological modeling framework to better assess healthcare practices. So I thank you very much for your time and attention, and I want to thank all the people that made this project possible.